cardiac and renovascular complications in type 2 diabetes. Is there a hope? Definition. According to the current posting on the website of World Health Organization, the worldwide prevalence of diabetes mellitus among persons of 18 years older is 8.5% and increasing. Most of those affected by type 2 diabetes, which has been epidemic for several decades and is associated with many complications, including premature macrovascular and microvascular disease affecting the eyes, heart, kidneys, and the circulation. We know that diabetes is associated with major morbidity and mortality, with estimated 1.5 million deaths in 2012, being directly due to diabetes.
Because you no longer have enough insulin circulating in your blood, your cells can't get the glucose they need to produce energy. As a result, your body turns to fats and proteins as an alternative source of energy. During the fat breakdown process, certain byproducts, known as ketone bodies, accumulate in your blood, resulting in a condition called ketosis. If ketones build up to dangerously high levels in your bloodstream, you may develop diabetic ketoacidosis, or DKA, which can lead to coma and death. Another complication resulting from failure to treat hyperglycemia is called hyperosmolar hyperglycemic non-ketotic syndrome, or HHNS. As the insulin deficiency continues, your blood glucose level increases. In response, your kidneys filter excess glucose out of the blood into urine, along with large amounts of water. Unless you consume large amounts of water, your kidneys cannot keep up with the demand of removing the glucose from your bloodstream and diluting it sufficiently in urine. As a result, your blood becomes much more concentrated than normal, a condition called hyperosmolarity. Hyperosmolarity pulls water out of your body.
Pros and cons. There are no pros in this disease. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it, but over time it isn't able to keep up and can make enough insulin to keep your blood glucose at normal levels. Here's the video.
Hello everyone, my name's John, and I was diagnosed with type 2 diabetes some years ago, and I'm here to tell you my story and some things about type 2 diabetes you may not know. You've just seen the prevalence statistics for diabetes. We all know that this epidemic is having an overwhelming impact on society and healthcare spending worldwide. So, why is this often preventable, manageable illness causing such devastation? The answer lies in truly understanding how the whole body is affected by diabetes. The heart, blood vessels, brain, kidneys, liver, eyes, and nervous system. And that is why I'm here. The hormone insulin plays an important role in controlling blood glucose. Insulin allows sugar, glucose, to enter cells of the body from the bloodstream where it is used as energy, such as in muscle or brain cells, or stored, such as in liver or fat cells. Type 2 diabetes occurs when insufficient insulin is released or the body is unable to use insulin properly. This can lead to an insulin secretion deficiency or insulin resistance, which plays a key role in developing hyperglycemia or elevated blood glucose, and eventually type 2 diabetes. As a result of hyperglycemia, glucose accumulates in the bloodstream, causing acute diabetic symptoms such as tiredness, blurred vision, thirst, and frequent urination. Diabetes is also a chronic lifelong condition and thus requires careful control. Without proper management, damage may occur to widespread bodily functions. These are termed microvascular complications, which can affect the eyes, feet, and kidneys, or macrovascular complications, which can affect the brain or the heart. Microvascular complications of diabetes can impair eyesight or cause vision loss. Excess blood sugar can cause nerve damage. Over time, high blood glucose levels damage the kidney filtering systems, allowing protein into the urine, a condition called microalbuminuria. Longer-term, excess glucose consumption progresses to a condition known as diabetic nephropathy. As a result of diabetes complications, in severe cases, patients can experience kidney failure requiring dialysis or transplantation. So, now that we've looked at the microvascular complications that can arise from diabetes, we'll turn our attention to the macrovascular.
Application in medicine. Various approaches in the treatment of type 2 diabetes have been introduced recently, but whether these therapies alter cardiovascular and renal risks remain uncertain, despite weight control by diet and response in some patients by gastric bypass, and the use of recent developed oral hypoglycemic agents and easily premature cardiovascular disease, kidney failure, renal disease, and peripheral vascular disease develop in patients with type 2 diabetes.
People with diabetes have an increased risk of developing a number of serious health problems. Consistently high blood glucose levels can lead to serious diseases affecting the heart and blood vessels, eyes, kidneys, nerves and teeth. In addition, people with diabetes also have a higher risk of developing infections. In almost all high-income countries, diabetes is a leading cause of cardiovascular disease, blindness, kidney failure, and lower limb amputation. Maintaining blood glucose levels, blood pressure, and cholesterol at or close to normal can help delay or prevent diabetes complications. Therefore, people with diabetes need regular monitoring. Cardiovascular disease affects the heart and blood vessels and may cause fatal complications such as coronary artery disease, leading to heart attack and stroke. Cardiovascular disease is the most common cause of death in people with diabetes. High blood pressure, high cholesterol, high blood glucose and other risk factors contribute to increasing the risk of cardiovascular complications. Kidney disease, diabetic nephropathy caused by damage to small blood vessels in the kidneys leading to the kidneys becoming less efficient or to fail altogether. Kidney disease is much more common in people with diabetes than in those without diabetes. Maintaining near normal levels of blood glucose and blood pressure can greatly reduce the risk of kidney disease. Nerve disease, diabetic neuropathy, diabetes can cause damage to the nerves throughout the body when blood glucose and blood pressure are too high. This can lead to problems with digestion, erectile dysfunction, and many other functions. Among the most commonly affected areas are the extremities, in particular the feet. Nerve damage in these areas is called peripheral neuropathy and can lead to pain, tingling, and loss of feeling. Loss of feeling is particularly important.
Issue apply in Ecuador. In 2020, it was estimated that the number of people suffering from diabetes in the Americas was 35 million, of which 90 million were in Latin America and in the Caribbean. Projections indicate that by 2025, this number will increase to 64 million, of which 62% live in Latin America and the Caribbean, representing approximately 40 million. In Ecuador, the prevalence of type 2 diabetes is 44.1% to 5%. Conclusion. In the coming years, control and comparative effectiveness trials that uniformly combines newer agents with older agents may help to delineate an even more effective treatments planned for the millions of people whose lives are affected by type 2 diabetes. Thank you.